Today we are going to talk about a serious problem that's affecting our little ones, childhood obesity. Data is showing that childhood obesity in Sri Lanka is increasing. In fact, there's been a 15% increase over the last decade. In 2019, studies have shown that almost 20% of school-going children are having either are actually overweight or obese. So certainly it's a serious issue that we need to address. So why is this happening? It's probably a combination of the easy access to high-calorie junk food, larger portions, in drinking too much of sugar-containing beverages, coupled with the fact that more and more children are now hooked to devices either for their studies or for their games, and the tuition culture that is prevalent. So more and more of our children are eating more and moving less. And this combination seems to culminate in childhood obesity. So childhood obesity can lead to many problems. Certainly in childhood itself, they can be a target for bullying. There can be a lot of mental health issues and certainly physical limitations. But in the future too, obesity in childhood can lead to adult obesity and the prevalence of non-communicable diseases such as diabetes, heart problems, and cancer. So it is important to address it early. So the journey towards improving childhood health and reducing obesity starts before birth, actually. So from the time that the mother is pregnant, it's important to look into the mother's nutrition, and preferring healthy foods and keeping active is very, very important so that the fetus does not become overly large. So obesity or fat deposition can actually start during pregnancy. And then after birth, focusing on breastfeeding for the first 6 months is very, very important. This ensures that the child gets the best nutrition without any excess exposure to overly high calorie food. And after 6 months, when introducing solid food and external foods, it's important that mother is aware of what are the healthy foods that the child can eat. It's best to avoid sugar and excess salt at this early stage, at least for the first 2 years, not to introduce packaged foods. Best to go with locally produced, fresh produce. Monitoring the growth of your child is very important, and this is usually done at your doctor's office. The doctors usually have a growth chart, and you can see how the child is growing. Often, parents like to catch up if the child is a little small, to catch up, to eat more and catch up with a higher level of growth chart. But this is very important to discuss with your doctor. It's best if the child grows at his own steady state rather than trying to catch up with the next level of height and weight. Physical activity is another important aspect of healthy childhood. It's important that a child which is less than 2 years old is active throughout the day. And older children spend at least 1 hour playing or in some sort of sporting activity. At the same time that you increase physical activity, it's important to limit the use of devices such as iPads and phones and TV. Children under the age of 2 years actually should not be exposed to devices at all. They should be playing and being active and observing nature to get their stimulation. And older children should limit their device time or screen time to less than 2 hours for a day. When we talk about healthy eating, there are a few things to think about. Always replace sugary foods with non-sugary foods. Sweet treats should not be the treat. Remember to tell the grandparents as well not to use sweets as a reward. They can use other things such as books or time spent with them as the reward for good behavior rather than using food and sugary treats. encourage drinking water than any other sugary drinks, especially fruit juices or carbonated drinks. Eating local healthy foods, vegetables are very important, and learn from your dietitian or your doctor about healthy, balanced diet. Another aspect of healthy eating is family meals. Encourage eating with the family rather than eating in front of TV or walking and eating or running and eating. A family should get together at least once a day to eat together so that they can not only eat a healthy, balanced food, but also talk about the day, because this helps the child grow mentally as well. Another very important aspect of childhood health and childhood obesity is sleep. Very often we find children, especially between the age of 10 to 15, when they have the ability to use phones, they are on the devices till very late. Sometimes they are studying at home till very late. So it's important for the parents to encourage sleep, because a good sleep allows them to be active and alert the next day. Good sleep also prevents obesity. Children under the age of 2 should be sleeping at least 11 to 14 hours. And children in between the ages of 3 to 5 should be sleeping at least 10 to 13 hours. And older children should try to catch up at least 9 to 12 hours of sleep. And teenagers can manage with about 10 to 9 hours of sleep. So these are very important. Don't skimp on the sleep. It's important to sleep so that you are healthy every day. Remember, preventing obesity is far easier than treating obesity in childhood as well as in adulthood. So let's take a few healthy steps towards making sure that our future generation is much healthier. At Suwa Diviya, we have focused seminars and workshops for children in schools, as well as workshops in healthy eating and cookery. So do call us and let's make sure our children grow up healthy.